So today's content is going to include diving accidents and how we treat diving accidents both on the scene and then in the hospital as well. This is going to be kind of the opposite of when we talked about high altitude injuries. Okay, so we are going to start with the different types of injuries that we can have. We have descent injuries, so that's going down in the dive and increasing our pressures, increasing the depth of the dive, so compression injuries. Then we have bottom injuries, and then we have ascent injuries. So bottom is, we've gotten to the furthest depth that we're going to go on our dive, and what is going to happen during the dive. And then ascent is going to be coming back up, so going towards the surface of the water. We'll go into detail about how these injuries happen physiologically, how they can be avoided, and how we treat them. You're going to need to know signs and symptoms of each of the injuries and be able to read a little scenario and know what injury they have and then be able to treat it. Okay, so the first thing we're going to talk about is gas laws that are associated with diving accidents. Yay, I know these are your favorite, but the first thing that we need to talk about is Boyle's Law. So know Boyle's Law. And Boyle's Law states that if we increase pressure, we are going to decrease our volume. Excuse me. So when we are diving, we're increasing pressure because the further you go in depth in the water, the more pressure you're going to have above you. So let's draw a little illustration. Okay, so we're going to say this is the surface of the water. And when we're at the surface, we're at 1 atmosphere, 1 ATM. As we continue to go down in depth underneath the surface, every 33 feet, so 33 feet, is going to equal 1 atmosphere. So we're going to put this as 33 feet here. So when you dive to 66 feet, you are at 2 ATMs. So we're going to say if this is our little diver here, stick figures is as good as you're going to get. And he starts to go down for his dive and he ends up down here. Every time he continues to go down in atmosphere, we're going to have an increase in pressure. We're increasing pressure. And that's what Boyle's Law states. So when you think of gas being pumped into an enclosed space, to fit into a container, we'll say we increase pressure, right? And it's going to squeeze it. So think about our lungs. Our lungs are hollow organs. So our lungs can hold about 6 liters of gas. As we increase pressure, we're going to decrease that volume. So as we increase pressure, we decrease our vital capacity. Okay, we decrease how much of our TLC we have, so total lung capacity. And this will bring us to our first injury of descent. So always be able to pick out which injuries are descent injuries, which injuries are bottom injuries, and which injuries are ascent injuries. Okay, so it's going to be a problem of compression when we talk about descent injuries, because as we're going down in depth, we are increasing what? We are increasing our pressure. So our body is having to equalize for the surrounding pressure that is now squeezing on our body. So these are squeeze injuries. Our hollow organs are going to be at the highest risk. So our lungs, our sinuses, our heart, and our ears are going to have the highest risk, but ears are going to have the most common injury. We're going to go into the next slide. We'll go into why that is and how we can treat it and prevent it. So lungs are hollow, but as long as we have clear sinuses, we don't have any injury to our lungs like an infection. We'll get into talking about asthma in a little bit. As long as we're healthy or we're at least at our baseline, lungs aren't going to be as affected because we're going to have breath holds. So as we go down in depth, we're going to take a breath in and we're going to hold it because our body's going to acclimate and not allow that squeeze to get rid of the pressure and the air in our lungs. So sinus cavities are going to be affected. It can be painful if we have a squeeze injury there or in our ears. They are painful, but they're not usually emergencies. Okay. And the second type of injury is the mask squeeze. So we have sinus and ear injuries and mask squeeze, and we'll go into more detail in just a second. Okay. So our ear injuries. So Barrettitis media. This is a diagram of a healthy ear. So we have a little pocket of blood and fluid, and this blood and fluid moves in and out of the eustachian tube, or moves down, I should say, because it's going to give us our equilibrium. It's going to acclimate as we increase or decrease pressure by increasing or decreasing altitude. So think about when you drive up to the mountains and your ears feel like they need to pop, and you chew gum, or you're flying on a plane and you take off and it just means that you are increasing in altitude or decreasing, and your body hasn't been able to equalize the outside atmospheric pressure to the pressure inside your eustachian tube. Okay, so the biggest sign is going to be pain with this, right? So pain is going to be the biggest sign, excuse me. And if somebody is in pain, they can tend to panic, and that can lead to ascension. So they're going to ascend, which if they're in pain, they should ascend. But if you ascend too fast, that's when we can have bigger problems. So if we ascend too fast, we're going to talk about air embolisms. We are going to talk about decompression sickness. So ascending properly is going to be key. Now, if they ascend too fast, then they can have other issues, or it can cause them to bleed. So it can cause bleed. So your pressure is not being equalized. And then we can lead to middle ear barotrauma. So that means that whatever is happening here, that we can damage the tissue, we can rupture an eardrum, or if the blood and the fluid move, that helps equalize our equilibrium, our pressures, then we can get cold water in the ear. So cold water in the ear after we have some type of trauma can cause confusion. It can cause ear damage. It can cause eardrum rupture. So when divers are diving, they should not forcefully try to clear or pop their ears, because that can cause a rupture. The more rupture, or the more forceful it is, the more damage they have, the more pain that's going to cause. So we don't want to cause pain, we don't want to cause panic by the pain and rush to the surface, because then that's going to cause two bigger issues. Typically, this will heal in about 3 to 7 days, depending on the severity of the damage. Okay, so the mask squeeze injury is going to be when a diver forgets to exhale. So diver doesn't exhale through the nose. So as they're descending, they should be exhaling a bit through their nose to prevent the mask from squeezing and squeezing and squeezing and squeezing and being pushed. They're not going to get water in their mask when they exhale through their nose because there is so much pressure. That exhale is just loosening it enough so that it's not going to cause the injury that you see to the picture on the left. It usually is not as bad as it looks. It looks painful, but it's those capillaries that are bursting that cause the blood to pool. Treatment is usually not needed unless there are vision changes or we have increased interocular pressures. But typically, it's not going to need treatment. It can take 2 weeks to heal, and it is gravity dependent, right? Because blood and fluid are going to settle to the bottom part of wherever the capillary beds are that had burst. Okay, so bottom injuries. So be able to identify these different types of injuries here. Okay, so nitrogen narcosis, oxygen toxicity, carbon monoxide poisoning, and hypoxia or asphyxiation are all bottom injuries. So this is occurring after we get down past descension and to our deepest depth of the dive. Or if we have multiple depths, and this is going to be when we're looking around. The divers are at the deepest points of the dive. So everything is going to be dependent on duration, so how long they're at the bottom, and then the depth, how many atmospheres. Remember, 33 feet is an atmosphere. So the further we go down, the more pressure we have. The more pressure we have, the more likely we are to have a bottom injury if we're not trained properly. We're not working on prevention to prevent these from happening in the first place, or if we're not a skilled diver. So depth and duration are both going to be predisposing factors. So depth and duration. So time and pressure pretty much, right? So the more exposure we have to this high pressure, the more we're putting our body at risk and under strain. So before we dive, divers are going to use dive table calculations. And if you've dived before, most equipment today will have computers in them that does this for you when you put in the depth. It'll give you a time frame of how long you can stay at that depth. It's going to also tell you about multi-level dives. So multi-level dives mean that you're going to go deep and then you're going to ascend 60 feet, let your body acclimate and go back down. So dive table calculations are going to tell you also how fast to ascend to prevent those ascent injuries as well. Most equipment today will beep. If you're going too fast, it beeps when you get to a certain PSI on your tank that you were taking, and then how long you can go before you go any further. So dive table calculations is prevention for bottom injuries and ascent injuries. So know how to prevent, know prevention, and why you use these, okay? Nitrogen narcosis is also known as rapture of the deep, so be able to use all these terms interchangeably. So nitrogen has a narcotic-like effect. At higher pressures, it is more likely to be able to cross the blood-brain barrier. Every 50 feet, there is a mental correlation effect, right? So every 50 feet, equals one martini. The effect is that's why you hear it. You also hear it called the martini effect. And it's noticeable at 100 feet. So think about why this can be extremely dangerous. We are 100 plus feet underwater, and all of a sudden we have nitrogen crossing the blood-brain barrier. So people start to get euphoric, they can become disoriented, they can lose balance and have vision changes, slow reaction time. And then, so they're feeling tipsy. Do we make good choices when we're tipsy or drunk? Typically not. So we are worried about making good choices. That could be taking out their oxygen or their gas out of their mouth and not breathing. It can be swimming away from the group or touching an animal or doing something that you shouldn't do. So that's why it's important to always dive in groups. So we can be accountable for one another. Okay, so this is due to another gas law, and this would be Henry's law. And Henry's law is the law of solubility. So because we have the pressure, nitrogen becomes more soluble and it's able to cross the blood-brain barrier. So to prevent this, so prevention is going to be key as well. You need to keep your workload low because not only the deeper the dive, the more nitrogen we're likely to have, but physical and mental stress is also going to make it worse. So we want to decrease stress. We also don't want to drink 24 hours before we dive, okay? On deep dives, replacing nitrogen with helium is going to be key. So replace nitrogen with helium. And we can do this by diving with a mixture of gas. So when I talk about adding a mixture of gas, and we remember, we had helium here, right? So we are going to dive with heliox for deeper dives. Usually dives that are greater than 150 to 165 feet. And this is going to mix nitrogen, oxygen, and helium, also known as heliox, okay? So this would be prevention, right? Because the best treatment for diving accidents is prevention. Remember, helium is lighter, and so the deeper the dive, it's going to increase pressure, right? And that's going to carry oxygen better to the brain. Okay, let's talk about some symptoms again. We'll write them out. So symptoms: confusion, stupor, tunnel vision, disoriented, and all of these are panic. They can panic. Panic. And if they panic, they're going to race to the surface. And remember, if they're experiencing really bad symptoms, that means they're really deep. They're 100 plus feet below the surface. So if they race to the surface, They are more than likely also going to have ascent injuries, which are more dangerous than just nitrogen narcosis. So our treatment, if somebody starts acting like this, is going to be ascend safely, just a little bit. So a little bit at a time. A good rule of thumb is never to swim faster than your bubbles are going to the surface. Okay, takeaway for gas laws. So Henry's law, sorry, I did not spell that right. So Henry's law equals an increase in pressure equals an increase in gas solubility. Okay. Oxygen toxicity is going to be our next bottom injury. So if we are diving with 100% oxygen tank, the FiO2 that we're breathing in through this tank here is going to be 100% oxygen. We risk oxygen toxicity. So if we increase inspired pressure of oxygen, we have an increased risk of oxygen toxicity, especially if we have healthy lungs, right? That AC membrane isn't damaged, and we're going to get more oxygen bound to hemoglobin. So we can have damage within hours to our lungs from too much inspired oxygen. So we can have vertigo, which would be dizziness, ringing in our ears, disorientation, seizures if it's severe, and then we risk drowning, right? Or we risk submersion, okay? Numbness, muscle twitches, we can have flashing lights. We talked about ringing ears. So we want to either, so this would be prevention, we want to either dive with room air. The scuba diver in this picture has nitrox, which is nitrogen and oxygen, heliox. So there's 3 different mixtures. It's going to depend again on depth and duration. And heliox is going to be more expensive to rent than nitrox because helium isn't as available. So there are different options for that. So room air would be 21% FiO2. Nitrox is going to be 33%. So if you see a question about treating oxygen toxicity, the treatment is going to be ascension. So we're going to ascend safely. Ascend safely. Okay, and it doesn't last long. So as we ascend, we're going to decrease that pressure. So, right, because we know we're under a lot of pressure, it's going to be easier for the oxygen to cross the AC membrane, so ascend safely. It doesn't last long, but treatment would not be to put them on oxygen, right? They have oxygen toxicity, so ascend safely. Carbon monoxide poisoning. So carbon monoxide under the water can be a contaminated tank. So you're going to want to get your tanks from a reputable place. You want to examine your tank, maybe see where the place is coming from. So faulty connectors from where the compressor is to use to fill the tank with whatever type of tank you're using, and the compressor isn't working properly, and then it's putting carbon monoxide into your tank, and you're breathing that in, and you know carbon monoxide has a higher affinity for hemoglobin than oxygen. So our patients, the hallmark symbol is going to be cherry red lips. Cherry red lips. Okay. So shortness of breath, nausea, headache, They can vomit depending on how much. So research the tank company, maybe get a gauge that measures carbon monoxide levels and oxygen levels. And our biggest treatment is going to be getting to where the good air is, which is where? At the surface, right? So the most important thing to remember is that we send safely, or as safe as possibly. The faster we shoot up to the surface, the more risk we are at for the scent injury, okay? So oxygen, oxygen, oxygen is going to be the best treatment for carbon monoxide poisoning. We want 100% FiO2. So that's putting them on a non-rebreather or a mask as soon as we get them out of the water. And as soon as they get to the hospital, we're going to give them as much oxygen as possible. Depending on the severity of the carbon monoxide poisoning, we are going to treat them with a hyperbaric chamber, right? Also ironically called diving, because we're going to increase the pressure from 3 to 6 ATMs. This would have to be a very severe case for 6 ATMs, right? Because that, when we're diving in an HVO, it's going to force all that oxygen that it can onto the hemoglobin. So severe cases, hyperbaric chamber. Make sure that you know what you are using to test for carbon monoxide poisoning. Hypoxia and asphyxiation is probably the most preventable injury. So it's doing things like a standard practice of not coming up with less than 500 psi of gas in your tank. Just like when you're taking patients on transports at the hospital, you don't want to take them with a oxygen tank that has less than 500 psi. You want to make sure that you don't have any health problems. You are not diving deeper than what you're trained for. That you have the proper gauges, your gauges are working and they're calibrated properly, that you're going to a reputable place to buy your gauges, and that you're getting your equipment serviced. Hypoxia and asphyxiation will lead to submersion and drowning. Okay, and then we can have a patient that is a diver and they may have multiple injuries that becomes a submersion victim as well. So now we have this whole hot mess of a patient that we're treating hypoxia, remember, with drowning. Treating hypoxia and treating with oxygen is going to be the first thing that we need to do. Ascent injuries. Ascent injuries are the most dangerous and hardest to treat injuries for diving accidents. Okay, and diving accidents don't just happen in the ocean. We can have swimming pools, lakes, any body of water, we can have accidents as well. So our biggest ones are going to be air embolism and decompression sickness. And we're going to talk about each of those individually and in great detail. So just like the rest of the injuries, the biggest thing that we can do to treat these is prevention. And no, the faster the ascent, the faster that somebody comes up, the bigger the ouch. So that means the worse the injury can be, right? So that rule of thumb of not swimming faster than your bubbles, when you exhale into the water, the safer the ascent's going to be. That's why you need to have those proper gauges, understand your calculation and your dive times, and proper training. Okay. Air embolisms are the most common diving injury, and they're also the most dangerous. Okay, so when we hold our breath going down, going deep into the ocean, the water, wherever we're at, we hold our breath in because that pressure is increasing. And because we're increasing pressure, we're decreasing volume. But the opposite happens on ascent. So Boyle's law is still in play here. If we decrease pressure, we're going to increase volume. So now all of a sudden our lungs are expanding again. So if we hold our breath we're still going to decrease the pressure and that volume is still going to expand. Okay, whether we are holding our breath or not, the volume's going to expand. Whereas, at least if we're breathing, we are controlling the volume. So, on ascent, we do not want to hold our breath. If we ascend too fast, so when you are ascending, you are going to have those tables, and your gauges are going to tell you how fast you can ascend. It will beep at you if you're ascending too fast. Once you go up every 30 feet, you're going to take a break and you're going to wait there, okay? And this is going to allow for those hollow organs, your lungs, and to expand safely. Whereas if we expand too fast, then all of a sudden we have a rapid decrease in pressure and a rapid increase in volume, which is going to have air forced from the lungs into the blood vessels, right? We can have alveolar rupture. We can have pneumothorax. We can have ruptured capillaries, right? So we have to make sure that we're ascending slowly. So now you can see why it's such a big deal if we have our bottom injuries, panic, and all of a sudden we're going to rush to the surface. Here is just a visual representation of what's happening, right? So air is going to enter the pleural cavity, right? And as the pleural cavity expands, the pleura is expanding, our lung, depending if we have two pneumos or one pneumo, is not going to be able to expand, right? If we have our alveoli rupture, an air embolism can go into our vasculature, okay? Now we have an air emboli. So now gas is passing from the bronchi to the mediastinum. It's in our vasculature. It can travel to our brain, right? It can cause pulmonary embolisms as well. Because what an embolism is, right? Remember, it's blocking a blood vessel. So now we are blocking blood flow. We can have strokes. We can go into cardiac arrest. We can go into respiratory arrest. Okay, so these are very serious. You need to be able to know these signs and symptoms. Okay, so modeling, and we'll go on to the next page in a minute. This is the worst symptom, right? They're near death. Okay, not every patient who has an air embolism is going to have modeling. Okay, so these are patients that are about to die. Okay, frothy blood in the nose and the mouth. So now we have alveolar rupture, we have a submersion victim, we have pulmonary edema. Okay, so frothy blood in the nose and the mouth. We can have also capillary rupture as well, causing that blood to be there. And what makes it frothy is the surfactant. Extreme pain, especially in the muscles and the joints, because those emboli, and it's probably not going to be just one air emboli, it's going to be multiple, can cause pain because there's not tissues being perfused, and they're more likely to be stuck in the joints and in the muscles. Dyspnea, that should be obvious. You also need to know signs of a pneumothorax. Okay, pneumothorax and a tension pneumo. So when it's a tension pneumo, you're going to also have JVD, which is jugular venous distension. Remember, we can have tracheal shifting, and when we get to a tension, they're going to be hemodynamically unstable. So they're unstable. So their blood pressure is not good. It's just bad news bears. Dizziness, vomiting. So symptoms are going to vary depending on the severity of the emboli, how fast they ascended, how long have they been out of the hospital. So we want to treat them with oxygen as soon as possible. And we're also going to treat them with HBO. Okay, so this is what a picture of modeling looks like. So modeling, you can see how you have the patchy colors here. You have white, and then you have purple blue. So this is going to be someone that has multiple air emboli everywhere. So the perfusion isn't equal, making that modeling shape. And this is our patients who are near death, very, very severe. So treatment, BLS, if there's no heartbeat. So if we don't have a pulse, we're going to treat with BLS. We want to make sure we keep them calm, because if their heart rate is elevated and they're tachycardic, then that's just going to pump more air emboli all over their body faster. Okay. We want to try and keep the patient on the left side with feet higher than their head. And this is going to reduce the chances of the air emboli going to the brain. And then we are going to treat with the hyperbaric chamber, because that's going to reduce the size of the air emboli. Because it's Boyle's law, because we're increasing pressure, we're going to decrease that air emboli. This would not be a good candidate for air transport unless they're flying at very low altitudes, because we're still, if we get in a helicopter and we go up, then we do what? We're decreasing pressure more, and then our bubbles are going to get bigger. Okay. Decompression sickness is our second ascent injury, and this is the bends. And it's nitrogen again, but now we have tiny nitrogen bubbles, okay? And depth and duration are going to affect this, right? Because nitrogen is more likely to do what as we increase in depth. Henry's law tells us that gas is more soluble, so we're going to have more nitrogen crossing the blood-brain barrier, right? So we know we have more of that nitrogen in our vasculature. So if we go up too fast, it's just like air embolism. We're going to have that nitrogen expand, okay? Those tiny Dane nitrogen bubbles. So we want slow ascension, about 60 feet per minute, because these bubbles, again, are going to obstruct our vessels, especially in the joints, and it's going to cause pain and damage within a short amount of time. And think about the blood-brain barrier is in our brain and our spinal cord. So if we have our major cerebral or spinal vessels blocked, we can have permanent spinal cord damage, because that spinal cord tissue is going to become ischemic. And we don't want that. So the treatment for decompression sickness is going to be the hyperbaric chamber, okay? So the most dangerous is going to be air emboli. Nitrogen is going to be the second, just because we don't want to have those occluded vessels. Okay. Diving in asthma. So we have a decreased breathing capacity, or reduced, I should say, due to pressure with patients with asthma. So they're more obstructed, right? And especially depending how well they take care of themselves, if they've recently been sick, they may have issues having that total lung capacity as they have, if they go to really deep dives. They also may not be able to exhale everything properly due to air trapping on ascent. So they're going to be a higher risk for pneumos and ascent injuries as well. So they need to make sure they're healthy, they're at their baseline, and that they're really not diving too deep. So other hazards, bites. So interesting story. This is a picture from my clinical director's one of her dives, and that's a barracuda, and barracudas like shiny things. You should be mindful of where you're diving, what type of gear you're diving, and not to splash around and look like a fish or a turtle. Don't chase things. Don't draw attention to yourself. Kind of give fish their space, so you can prevent this. Interesting fun fact, a third of shark attacks happen on divers. Stings and rashes. So many things can cause stings and or rashes. They can inject toxins. You can have wounds. So wash with vinegar. Watch for anaphylaxis, okay? Sea urchins, you should use Epsom salt or mag sulfate. If you get stung by a jellyfish, do not pee on your friends. It is a myth. Okay. So make sure that you understand the different types of injuries and be able to separate them from where they happen, descent, bottom, and ascent. Know your treatments and signs and symptoms as well.